Hello, my name is Deborah Moore, and I am a Deputy Director at the Houston Health Department. As a member of the Houston Health Department's leadership team, I want to share an important message with you about COVID-19 vaccine confidence. My staff and I have worked with members from the community to create videos about vaccine confidence and to share messages about why they got the vaccine, why some people were hesitant to get the vaccine, and why they now have confidence in the COVID-19 vaccine. All of the people in the videos have been vaccinated, and they share the commitment of the Houston Health Department to encourage our community to take your best shot and get vaccinated. I hope you enjoy these videos, and if you have not been vaccinated, consider the messages from these community members. If you've gotten the vaccine, thank you for your commitment to protecting the health of yourself and of others. Please share these videos with friends, family, and anyone you think will benefit from these messages. If you would like to schedule an appointment to get the vaccine, please contact the Houston Health Department at 832-393-4301. We want to ensure we work with you and with all of Houston to promote and protect the health of our community.
Personal with me because I know some friends who personally have lost their lives to the COVID vaccine, and I have family and friends that I'd like to see.
I decided to get the vaccine because of my health, my friends, family, and the people around me.
Decision to take it, and also I play baseball, so I want to protect the other guys from the team and also my mom.
When they said that I could be asymptomatic and carry it and get other people, I just couldn't live with the fact that I might because I made a decision not to take a vaccine, that somebody else could die.
Well, getting vaccinated is about preventing hospitalization and saving lives. I didn't want to take the risk of getting COVID, and so therefore I chose to get vaccinated. I also didn't want to take the risk of exposing my wife, my daughter, and particularly my grandson to COVID.
My grandmother had passed away from COVID, and so I thought, I really don't want to suffer that fate as well. And so I went ahead and decided to get the vaccine to prevent anything from happening and also from preventing any spread to my children.
I work in the community a lot, and I don't know who I interact with. If they're aware of COVID symptoms, if they might have symptoms and they don't realize that it's COVID, they might say, oh, I just, I have a cold or something. So I thought it was important to protect myself.
I was probably more afraid of getting the virus than the vaccine. So to me, it was virus or vaccine. So I decided to get the vaccine. I did not want to get the virus.
I changed my mind. I'm more in the community, and I just felt led to do the right thing. And that's why I decided to get it.
Well, it was really a no-brainer for me. First of all, I have a family and I have myself to worry about. And I've been able to see firsthand what this virus can do to people. And so there was no question in my mind that I was going to get vaccinated as soon as I can.
The fact that if the more people to get the vaccine, the more we can get toward being the so-called normalcy without wearing a mask and going back to the places we used to go to. So that's definitely a plus.
I look at somebody and they say, I haven't been to seen my congregation in at my church for 12 months. I haven't traveled the world. I haven't seen my grandchildren. And I tell them that's a really good reason to do it.
I would really tell you, just please go ahead and get the vaccine. I mean, you don't want to die from COVID. You've seen how many people it's affected. You've seen how many people up to this point have passed away. And you've seen the people, if you cherish your life, I mean, you don't want to be afraid of everything. Don't be afraid. I would encourage you to get it. If you want to continue to live and see your future, then yeah, okay, go ahead. I know some people are naysayers and they refuse to get it. They don't believe the vaccine works. I understand that. We're not forcing anybody to get it. But I think you should think about it yourself. And if you want the vaccine, contact somebody. Contact somebody who can help. Contact an agency or somebody who can help make that decision for you.
It's about preventing hospitalization and saving lives. If you take a couple of the vaccines, there is more than a 90-something% chance of you not being hospitalized or dying if you get COVID. And I kind of like those odds.
Of course, I'm ready to encourage everyone to get their vaccination. That way our health can be a lot better and our lives will get back to normal.
Would you rather be dead or maybe just get a vaccine that gives you symptoms for 2 days and then get it over with?
The first reason is the little kids. You have to protect the little kids and also the old people that is around us every single time. Taking the vaccine made me feel better because I know that I can prevent now the virus. So I prefer to take it. I prefer to have it and don't have it. So I can go to the field, I can talk to the other guys, I can take my mask up if I need it, and also knowing that I'm protected with the vaccine.
Those of us who have different disabilities, I think we need to go ahead and take the shot. I was nervous myself, but actually when I took my first shot, they did it so quick I didn't even know they had give me the shot until I had finished.
I got 1 in 50 chance of requiring hospitalization and then a 1 in 10 chance of dying versus a 1 in 100,000 chance of having an allergic reaction for which I will be treated immediately and do well, and then a 1 in a million chance of having a clotting problem. I'll go with the vaccine any day.
Well, I did a little bit. I didn't understand them doing it so quick with not doing a whole lot of research. But in the end, I just felt like there was a need and that I should go ahead and get myself protected because I do have underlying health issues.
Most concern I had was, wanting to get it sooner than I actually got it because I wasn't the first in line. Remember, we prioritized those individuals that were in clinical positions, and I think that was the right decision. No real concerns about it.
Oh yeah. At first, yes. Because the FDA didn't approve it just yet, and so I wanted to wait a few months before to see how people were reacting, to see what the word around town is, see what the pros and cons were. But I heard a lot of positive things about it, and so I thought, okay, let's go ahead and get the vaccine.
In fact, the same methodology is currently being used to look at vaccines that may be applicable towards certain cancers. So there's lots and lots of science behind this. This is not at all new.
Oh no, after getting the vaccine, I feel less worried and my health is normal.
The people always pull up the boogeyman. We go back to the Tuskegee experiment and things like that. But as my daughter expressed, today, now we are at the table. We are actually, it was a Black woman that worked on the COVID vaccine.
I was going to protect my neighbors by having the vaccine, having the shot, and that I was also going to be protected so I could see my grandchildren who live on the East Coast.
And I believe that the vaccine will help all of us. I mean, it'll protect us all from getting COVID. I mean, obviously we don't want to get COVID and we don't want people to die from COVID. And everyone prefers to beat it. I mean, there's so many people that have passed away up until this point, and the world is it's crazy right now. So I would encourage deaf people especially to get the vaccine to protect themselves.
Right now everything is kind of, to me, out of whack. And to get back to, normalcy, we need to do what we need to do by taking that shot, so we can get back to doing some of the regular things we like to do every day.
This is not about taking the vaccine or not take it. This is about protecting the other people that is around you, even your children or your dad or your mom that is a younger age. So this is not about taking it or not taking it. This is about protecting the other people that is around you. So take the COVID vaccine. If you're not gonna take it, also use your mask.
Those were some great videos and messages, and we want to thank all of those involved in making them possible. What was of particular note for me was the fact that people of all ethnicities participated in the clinical trials to ensure the safety and efficacy of the vaccines for all of us. Ensuring safety and effectiveness of medication and treatment is why it is so important for all of us to participate in clinical trials. Again, please share these videos with others. I thank you, and on behalf of the Director of the Houston Health Department, Stephen Williams, thank you for working with us to protect the health of Houston. We really are all in this together.